is Kelly Tebow, and I'm with the New Jersey Center for Tourette Syndrome and Associated Disorders. And I'll be your organizer for this evening and would like to welcome you to our webinar on understanding and responding to sudden onset tics in teens, an overview for individuals, families, schools, and clinicians. Thank you all for joining us. Before I introduce the speaker for tonight, I'm going to cover some housekeeping items with you. All participants are muted. If you have a question, please type it in your question box and click send. You may send questions during the webinar. However, we will have Dr. Hartke answer the questions at the end of his presentation. We will get to as many queries as time allows. And in addition to tonight's presenter, he is available to take your questions on the Wednesday webinar blog, which is accessible from our homepage under the heading Programs. This blog will be monitored for the next 7 days. Feel free to look and post questions as often as you like. Answers will be archived for future reference. If you missed part of the presentation or would like to watch it again, an archived version will be posted. We value your input, and in order to expand the webinar experience in the future, we need everyone to fill out the survey when you exit the webinar. The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse or recommend or make any opinion by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. So tonight, we are welcoming back Dr. Graham Hartke for his 9th webinar since 2011. His webinars have been attended by over 500 participants and downloaded over 1,400 times. So we welcome him, and we're excited to have him this evening. Dr. Graham Hartke is a New Jersey and New York licensed psychologist in private practice in Roseland, New Jersey, specializing in cognitive behavioral treatment of anxiety, obsessive compulsive disorder, body-focused repetitive behaviors, depression, tics, Tourette's, and Tourette syndrome, ADHD, oppositional defiance disorder, and high-functioning autism spectrum disorders. He also specializes in the area of sport and performing arts psychology. Dr. Hartke works with children, adolescents, and adults, providing therapy, behavioral assessment, and psychological evaluations. He graduated summa cum laude from Rutgers College, Rutgers University. He continued his training at the Graduate School of Applied and Professional Psychology at Rutgers University, where he received his master's and doctorate in school psychology. He completed clinical training at the Tourette Syndrome program and completed a concentration in sports psychology. Dr. Hartke is a New Jersey certified school psychologist, school supervisor, and school principal. He previously served as clinical director of the Tourette Syndrome Clinic at Rutgers and has been a frequent outreach presenter for NJCTS. Welcome, Dr. Hartke, and we look forward to your presentation.
Thank you, Kelly, and thank you everyone at NJCTS for making this happen tonight. And I want to thank everyone for joining us. This is obviously a very hot topic at the moment. I'm going to be covering a lot of information. So I will try to go through it and leave enough time for questions. Okay, so tonight's topic is understanding and responding to sudden onset tics in teens. And it's an overview, so we're not going to get extremely in detail on every area, but it's meant to be for individuals that have tics, for the families, schools, and clinicians that work with them. Okay, let me just make sure my screen is responding. Okay, so our agenda for tonight, let's talk about, we're going to answer 3 questions. What has been happening? Why is this happening? And how do we help these individuals, right? So we're just going to really get an overview of what is going on behind this recent rise in sudden onset tics. And most of these cases have been teens. Why is this happening? We're going to kind of go over different factors thought to be involved in this surge, and how do we help these individuals. So I'm going to try to dedicate as much time as we can to some strategies to actually address this. I know a lot of webinars and information really just talks about it, but I also want to talk about what we can do. And also we're going to go over some resources. Okay, and we'll have time for questions. So what has been happening? Okay, so since the start of the pandemic, so let's say approximately the beginning of March 2020, you know, around when it really hit in America and things shut down, there's been a sudden rise and a surge almost in cases of teens and young adults with rapid onset tic-like behaviors. So we're going to call them functional tic-like behaviors for this purposes of this talk. And this phenomenon has been occurring around the world, and it's widespread, right, in a parallel fashion. So what we've been seeing in America has been happening all over America, but also throughout the world on different continents. So it's not just America. There's been a correlation found between these functional tic-like behaviors and social media, such as TikTok. So other social media also, like YouTube's involved, but there's been a correlation that researchers have found here. And I want to point out, we're going to talk about this, that it's been for many but not all cases. So not every single case has TikTok been the main, been identified. In many cases, though, and some researchers have found, in their sample sizes, everyone has been, watching TikTok, but not everybody. So I want to point that out. And also, sometime around early last spring, last year, popular media outlets started reporting on this. So, you might have had a neighbor or friend say, "Oh, did you see in the Wall Street Journal or on Vice magazine, there was reporting on this." So it got mainstream popular media attention. So what are these functional tic-like behavior cases? They're a rapid onset, often sudden and overnight. So it's dramatic. Of usually complex motor and vocal tic-like behaviors. So it's kind of out of nowhere, someone wakes up, literally someone might wake up that morning and have really, really intense and complex tics. It's dramatic and exaggerated. So these are not, simple tics often. Usually they're, we're going to go through a list, but they're very pronounced movements. It's often extremely disruptive for almost every time. It's extremely disruptive for the families, individuals involved, destabilizing and potentially traumatizing. A lot of missed school, many hospital or doctor visits, ER visits are very common. And most of these cases have been with females that are teens. I would say a majority are probably between 12 and 16, but it goes all the way up to 25. But most of these cases have been female. We're talking about biologically female and adolescent. Okay, so these behaviors are classified as tic-like. They're different from traditional tics found in Tourette syndrome and other primary tic disorders. So we're considering, they're different than what you find in Tourette syndrome or chronic or persistent motor or persistent vocal tic disorders or transient tic disorders. We're going to refer to them as primary or traditional or typical tic disorders when I talk about those. They're called functional tic-like behaviors, also sometimes referred to as functional tics or psychogenic tics. They're consistent with a category of disorders known as functional neurological disorders, also known, historically known, and still some people use this term as conversion disorder. They have existed before. They are not brand new, but they have been relatively rare. So most clinicians would see a few cases if they worked for many years in clinics, but not like they were being flooded with these cases. Also suspected, besides these behaviors, is that this is occurring on a wide scale. So something called a mass psychogenic illness is suspected. So this is when a functional neurological disorder occurs on a larger scale. So a group of people are all kind of simultaneously experiencing similar kind of symptoms. So I also want to point out, like many of you are aware, clinicians definitely know, and schools are definitely aware of, there's been an increase in all mental health conditions, basically across the board since the pandemic, as stress, anxiety, and all the factors related to the pandemic have really increased other disorders and conditions, right? So referrals for primary tic disorders, Tourette syndrome, persistent motor and vocal tic disorder, provisional tic disorder, which are, for the sake of this discussion, I'm not going to go over the definition of them in more than this, but they're neurological disorders. So the traditional tic disorders are neurologically based, and they are sudden, rapid, recurrent, non-rhythmic, repetitive motor movements, vocalizations. So they're consisting of tics, and that's what tics are, the traditional tics. So there's been an increase in the tic severity for individuals that already have many disorders. So people that already had tics, many people were reporting that the severity of their tics were going up as the pandemic unfolded and stress levels went up, but also referrals for people experiencing other comorbid disorders and stressors went up for anxiety, depression, OCD, just feeling isolated, having more family discord, difficulty with school. Basically everything went up during the pandemic. So the increasing number of these cases, really, of the functional tic disorder cases or functional tic-like behaviors, really were starting to show up in tic specialty clinics. So there are a lot of places around, or not a lot, but there are many places around the country and around the world that have specialty clinics for tic disorders. And these are clinics that are unique in that they really capture what is going on because they get referrals for tic cases. So there was a study that recently came out in this fall where they looked at several clinics in Canada, Australia, London, or England, and the USA. And basically they saw a huge increase in these functional tic-like behaviors since March of 2020. So pre-pandemic, they were reporting about 1 to 2% of referrals. And after March 2020, they were reporting about 20 to 30% of referrals. So there was a major increase. I also witnessed a similar change while I was the clinical director at the Rutgers TS clinic, which is a specialty clinic in New Jersey for treating Tourette's syndrome. And in my prior practice where I have, it's one of my specialty areas working with tics. For Rutgers, we had a 97% increase after March 2020 in monthly referrals for females. So basically doubled. We had a doubling of how many females, and most of that females that we had after March 2020 were 14 years old, about 14 or 15 years old. We also had an increase of 6% monthly referrals for boys. So for males, there was a 6% increase, and for females, there was a 97% increase in referrals after March 2020. And they weren't all for functional type behaviors, but just in general, we had a huge increase in female referrals. So why is this happening? Okay, so why has this been happening? Here are some of the factors thought to be involved in this surge. So we're going to just kind of recap some recent events that I'm sure is on everyone's mind. And we're going to kind of cover functional neurological disorders, and more specifically, functional tic-like behaviors, which is a subset under that umbrella, right? It's actually a more rare subset. It's not usually one of the more typical functional neurological disorders. So I'm going to go over that. We're also going to talk a little about social media and psychogenic illness and the role that plays, or his thoughts will be playing. And I'm going to address questions about PANS and PANDAS, because PANS and PANDAS, which we'll go over, which is a response that the body has which can result in OCD or tic-like behaviors to usually a pathogen like strep infection or an illness, also results in sudden onset of severe symptoms. And it could, I think that's on a lot of clinicians' minds sometimes, if that's going on as well, especially since the pandemic of a virus was going around. And I want to address that because I know that's not really being addressed a lot in some other articles about this. So we're going to talk about that as well. So why is this happening? Well, obviously COVID-19 spread, there was a global pandemic. We had a lockdown, people were not going out. Everything shifted and changed to virtual work, virtual school, socializing was virtual, increasing stress, anxiety, isolation, sickness, even for many people who are experiencing death, either personally, had someone they know that they lost, or were just watching it on TV and hearing about it. It was a major disruption to life. Something that we have not seen on a global scale really in our lifetimes, right? So it really kind of affected people's sense of security, and is unparalleled. And I would put out there as could potentially be considered a collective worldwide traumatic experience. Whether how you want to define trauma, but it was a very impactful experience and it disrupted almost everyone's life, or most people's lives, in some way. So I'm not going to go more into that. There's lots of information out about that online. So let's talk a little about functional neurological disorder. Functional neurological disorder is something that is, like I said, it's also known as conversion disorder, and functional tic-like behaviors are considered a type of it, right? They're a subtype under that umbrella. Basically, it's neurological symptoms, motor and sensory usually, that are not explained by identifiable pathology. So it's not, there's usually many tests that are run. They can't find any abnormal, markers, any pathogens, any lesions, anything that would show that there's some kind of pathology, or as it is in other conditions. So it could also present similarly to other neurological illnesses like Parkinson's, epilepsy, stroke, and functional neurological disorders occur 2 to 3 times more in females than males. So in general, it's something that's we've known about for a while, and it often has more females than males. So that the fact that we're seeing that with the current spike with females is not odd for functional neurological conditions. Functional neurological disorders are actually a common reason people see neurologists. They're one of the more common reasons people go to a neurologist. So neurologists have a lot more exposure to this than even just psychologists or other doctors and therapists and schools. I mean, it could seem kind of rare, but neurologists often have a lot more exposure to this. They're difficult to treat, but they're treatable. That's something that's important to point out. It can be very disabling. Heavy healthcare use can be involved. There's often a lot of treatment coordination between multiple providers. It's also hard to get access to good treatment. People sometimes have to travel really far or go to certain kind of hospital programs. Often it's disabling to the point where people can't work or individuals can't go to school. It can be very disrupting. It's very often associated with trauma or stress, but it can occur without this. So, it doesn't always have to have some kind of stressful or traumatic event occurring. And it could be in the past or present. It could be something that happened a while ago. It could be more of a delayed reaction, but it can occur without stress. And it's often co-occurs with anxiety and panic, depression or dissociation symptoms. And can be associated with pain, insomnia, and fatigue. So sometimes people will have, a pain condition that's similar to a functional pain situation where can't really identify a cause, or will be a lot of reports of that. So it can be interwoven with these areas as well. Here's some examples of presentations. So abnormal movements, tremor affecting someone's gait, dystonic movements, posturing, and tics. But functional tics are relatively rare. They're not even on a lot of people's radars with functional disorders as much as these other ones. Paralysis or limb weakness. Sometimes people will just all of a sudden they won't be able to move a part of their body or feel very weak. It could be sensory, so reduced, altered or absent skin sensation, hearing or vision could be affected. People could have double vision, loss of vision, loss of hearing, psychogenic non-epileptic seizures. So functional seizures is a common one where it'll look almost exactly like a regular seizure, a typical seizure where would show up on an EEG that someone's having a seizure, but when they're tested, there's no activity going on that it's a seizure, but it'll look just like it. And also episodes of unresponsiveness that resemble a coma or fainting or just completely zoning out can happen. It could also affect someone's ability to speak. So their volume, articulation, have trouble swallowing, have a lump in their throat. And there are some others that relate to these that could be also added, but these are some common ones that might show up, in a neurologist's office or in a hospital setting. So the cause is unknown, right? We don't know the cause, and that's part of what. But one way to kind of describe functional disorders, the older term conversion, I think, does a good job of kind of describing what we think is going on, is that the brain takes a stimulus, so in the old-fashioned version was like it was some kind of, had to be a trauma or a stress. Now we know it doesn't always have to be that way, but it takes that stimulus and it turns it into a physical symptom. So there could be some kind of psychological stress, or and it converts it into a physical symptom, is one way to look at it. It's trouble with how the nervous system functions, and it's more of a software problem, not a hardware problem, is another way it's described. So it's not that there's any physiological problem, but it's the brain is not communicating in the way it should. Some areas that are impacted, so there's often thought to be a hyperactive amygdala, which controls our fear responses, and a less active cortex, which controls is our kind of control center of our brain. So we have less control over our brain. So it's kind of one model. Another model is looking at, there's problem with how the top of our top to bottom communication. So our brain is not communicating as well with our body. For a better explanation of these, the brain areas and kind of some of the MRI research on this, the Tourette Association of America did a webinar about a month ago that's available on YouTube if you just go to their YouTube channel. And there's some neurologists that talk about and kind of the specific brain areas impacted. But I just wanted to put this up here. Generally, this part, the MRI research in the brain areas, is not my specific specialty, but so I defer to that webinar for a better explanation. But this is just some information about what we think is going on in functional disorders. Some predisposing factors, right? So we don't know the cause, but some predisposing factors are psychosocial adversity, being female, having a physical illness, or kind of being exposed to illness. So oftentimes people who are around a lot of illness or suffering, if they're caring for a family member that's been really ill or in those situations, it's almost like your brain starts to mimic those conditions. Precipitating factors, so kind of a trigger, so that might really set it off. Would be like a physical injury, some conflict, some big, some extreme stressors, mental health symptoms, so having like a panic attack or some other symptoms might be precipitating like a trigger. And perpetrating factors are factors that help kind of maintain it. So oftentimes avoidance of, kind of getting back to your regular routines or some aspect of your life. Belief about your illness that it's not going to get better, or expecting that it'll always be this way, or some kind of social isolation. These all are kind of considered to be factors that help maintain this once it starts. So before COVID, the functional tic-like behaviors. So now we're talking about the subset of functional neurological disorders. I kind of showed you the bigger picture. We're zooming in a little more to the functional tic-like behaviors. They were observed and studied, right? So there are a bunch of studies that have been put out in 2019 that were really looked at this. There's not a lot of research on it, but there were about a year before the pandemic. These are documented cases. I, as a clinician, have had experience with working with these functional tic cases, even from my early training when I was at Rutgers many years ago. So it just happened to come up on my case load through the years, but it wasn't extremely frequent, right? So we knew about this before the pandemic. So it's new. What's new now, though, is not that these exist, is that it's been widespread and there's been a surge. So it's never been the case that we've had 20 to 30% increase in referrals for functional tic disorders and of females in like the span of a few months, right? That is not new. Before that, it was about 1% at any time. They're difficult to diagnose, and we'll talk about that. So it could be difficult to distinguish between a functional tic and a primary or a traditional tic, and it can be tough to diagnose when there's also a lot of other symptoms going on at once, because you want to rule out what's going on here. We'll talk about that too with PANS. So I want to point out here some information, because I think what I've seen in other articles and presentations about this, I want to be clear about this too. Functional tic-like behaviors may occur on its own. So someone might wake up one day and all of a sudden have functional tics, or have tics without a history of primary tic disorder at an older age. But it's also possible, and they do co-occur together, right? And there's the studies that were done before the pandemic, and we know this happens. So there are people that have both primary, like regular traditional tics, and they have functional tics. And sometimes they could be, we don't know if it's always functional or even a traditional tic for the same movement. So that could be the case. We call that a functional overlay. Or it could be, you know, one tic seems more functional, or one behavior seems more of a functional here, and other ones seem as primary tics. So this is why the diagnostic picture gets more complex, and this is why sometimes I think the cases that I actually see come, you know, when I, as a supervisor, and I've worked with and I talk to others about, often seem more complex than some of the ones that have been reported in some of the articles, and that sometimes people, it's not always clear if they've had tics before or there's accommodation. So it's not like you have only one or the other. You could have a mix. Some of the research I was done has shown that it was, you know, not always a mix, but it definitely occurs where there could be a mix. So here's some examples of these functional tic-like behaviors. Remember, they're sudden, abrupt, and dramatic onset. You know, life-changing, like all of a sudden you're doing something you've never done before and it's scary. Most of these movements that are the functional tic-like behaviors that come on suddenly involve someone's, you know, core, their trunk, and their limbs, right? And their arms, their legs, but often their arms, and their complex movements or vocalizations. Often things like immediately going to hitting yourself, hitting others, hitting objects, right? So wide swinging arms. As far as vocal tics, kind of immediately going to the more complex and less common carpolalia or echolalia, right? Repeating yourself, using profanity, and oftentimes changing the words you say, you know, it could be 20, 30 different words in like the span of a week. It might not be kind of like a traditional tic. If coprolalia happens, it's not as often. Usually it's kind of a similar few words, but it could be just changing, like a kaleidoscope of different words happening. So you could also be speaking with accents. Whistling and whooping is a common one that was reported. Complex leg and arm movements and other functional type symptoms. I've observed this. I haven't seen this as much in some of the articles written about it, but I also have noticed that people have other, they have tics and they seem functional, but then they also have some other functional movements that might not be exactly functional tics. It might be functional, some other type of functional, but kind of loss of functioning, like someone can't speak for a while, but it's not, you know, the usual. If it's a tic, it's kind of temporary blocking. It's like I can't speak for an hour and a half, or all of a sudden my legs give out and I fall, or I can't move a body part. Sometimes it can be tough to figure out if traditional, but often these are more of a functional type symptoms. So the recent study I mentioned before, which is one of the bigger ones, because remember, researchers have not had a lot of time to get together because the pandemic's only been going on for 2 years to get all these, you know, cases, you know, in this study from the fall, from Pringsheim, anxiety and depression are really common. So in the functional tic-like behaviors, we'll show the difference between functional behaviors and tic behaviors in the next slide. This is something that's really common. A lot of people had the functional tic-like behaviors, had anxiety or depression and or going on either before the tics or along with the tics, but often kind of happening before. Most in this study, there were about 20 people that they identified in this clinic study, so it wasn't a huge sample, had no history of previous tics. Of those that had a history of tics, I think it was 3 out of 20 that had a previous history of tics in this study. The tics were mild. Some similarities to primary tic disorders that they observed, some of the people that had these functional tics did identify an urge right before the tic happens, which is important for working with, you know, traditional tics, identifying the premonitory urge. And functional tic behaviors seem to be susceptible, similar to primary tic disorders, to distractibility and suggestibility. So if you start telling someone who has doing functional tics, oh, what if you know, move your arm this way? They'll say, why'd you give me that idea? And they might start moving their arm that way. Also, everyone in this study of 20 individuals reported that they had exposure to TikTok videos and TikTok influencers that were people that had tics talking about tics and showing their tics. Also, the people in this study, they found no association between acute infections such as what they have in PANS or PANDAS. So this is a recent study, kind of would say the most comprehensive at this point, because it hasn't been too long. So let's look at the difference between traditional tics and functional tic-like behaviors. Okay, so there is when you look at this chart, it kind of puts, you can kind of see that there are some overlaps. But on the top, I want to point out here, for onset and course, traditional tics normally start between ages 4 and 10 years old, right? The functional tics are almost exclusively happen suddenly when someone is an adolescent, right? It can happen, you know, on either end, or later or earlier. I mean, there are people that have traditional tics that develop them later, but on average, it's not the most common that someone would develop traditional tics later. So usually between the ages of 4 and 10. I mean, it's usually a gradual onset. Usually the most common tics for traditional tics are eye blinking, throat clearing, head jerking. Tics that start in the head area, and then as someone ages will move to the rest of their body, right? So from a head to tail kind of direction. And in contrast to that, the most common tics or functional tics are immediately complex tics, and usually don't start in the head. They're more of the whole body and moving your arms. So that's different. And one of the clear differences is traditional tics happen almost 4 to 1 more to males than females. Functional tics are mostly female. There are some males that have these. I don't want to say it's only female, but mostly a female. As far as the urge, you know, most people that have traditional tics report an urge before the tic happens. Usually it's something like an itch, or it feels like before you're going to sneeze, or some kind of pressure or an uncomfortableness in the area of the tic. Most people don't report a premonitory urge for functional tics, but some do. And when they do, it's often different. It's usually like a whole body kind of sensation, like a pulse of energy. Suppressibility means how much you could hold back your tics. Often people with traditional tics can suppress their tics temporarily, like holding back a sneeze. But people with functional tics often report that they can't really suppress it all, or if they do, they feel symptoms that don't normally get described by people that hold back traditional tics, of just kind of malaise or dizziness or even pain or nausea. As far as some similarities, both traditional tics and functional tics can be impacted by the environment, right? So in certain environments it might happen more or less, or distraction. The most common comorbidities for traditional tics are OCD and ADHD. The most common for functional tics are anxiety and depression. And both can be susceptible to suggestion and reinforced by attention from others. So I think this chart is pretty, kind of gives you a good picture of the difference. So let's talk real quick about social media and mass psychogenic illness. So a lot of people have been watching TikTok. TikTok blew up from like a few million views, like 50 million views in like 2 or 3 years, to like over, you know, I forget the number, but billions of views, right? The hashtag Tourette's has been viewed billions of times, especially in the past year. There are popular influencers online, people that do things like the Tourette alphabet challenge, where you have to, you know, people will say the alphabet while they're ticking, or try to say it without ticking. Many people view these videos, you know, obviously billions of viewers have viewed them, but also there's many people that post about their own tics on social media, so getting kind of a lot of attention from that as well. So some things I want to point out about this are many people who were experiencing these sudden onset tics were reporting social media. In some studies it was everybody. In some studies it was a lot of people, you know, like 70% to 80%. So it's definitely a correlation there with it. Tics and functional tics are susceptible to suggestion. So watching other people do it, you know, can influence. So anyone who's been at a tic, you know, conference or convention, or in a room with a bunch of people who have tics, knows that, you know, there could be, you know, it could set off an effect in the room, where a contagion effect, where someone might tic and someone else might copy that tic and echo it back, and it could set off a room of ticking. As far as tics being reinforced by consequences, attention and support, a sense of belonging, which are all part of the social media, are there, and you know, that's all part of it. But I do want to point out again, not everybody who had these sudden onset tics reports watching TikTok. So it's hard to say this is the definite cause for everybody. Mass psychogenic illness, I want to point this out. This is a really fascinating area of study of humans. It's a rapid spread of functional symptoms among members of a cohesive group. So social contagion. So it's functional disorder on a group level happening at the same time. In history, you know, there's documentations of convents of nuns who all start making barking noises, you know, like 400 years ago, or the Salem witch trials. Recently, about 10 years ago in Leroy, New York, it was all over the media. There was a group of about 19, mostly females, ranging in age from teen to young adult, who had a sudden onset of tics, of functional tics, right? And there was lots of, you know, media coverage, and they were looking for contaminants in the environment or causes. So it can happen. So it's not, but it hasn't really happened on this scale with functional tics, as far as, you know, anything we've ever seen. So common characteristics of functional psychogenic illness are a cohesive group, increased anxiety. A cohesive group in this case could be, you know, that everyone's on TikTok together. Increased anxiety, the pandemic, spread of symptoms via sight, sound, communication. There you go. And high female ratio. When there's confusion about the cause, when people have this illness, like so in like Leroy, New York, when it was disagreement, you know, is it a toxin in the environment, or there's different experts not agreeing, the symptoms tend to be worse, right? So when someone, you know, we don't know the cause, it seems to make the symptoms worse. And it's not as studied as individual functional neurological disorders. So there isn't a great deal of research on this. So let's talk about PANS. So pediatric autoimmune neuropsychiatric disorder, or pediatric acute onset neuropsychiatric syndrome, right? So PANDAS, I think I spelled this wrong in here, so oh no, maybe I did. So PANDAS is when strep infection is involved, and PANS is when there is other pathogens or other causes. PANS is now, PANS is now considered kind of the umbrella term for these both these areas. So it's also a sudden onset of severe behaviors. Usually it involves OCD, but also restrictive eating, tics, irritability and aggression, anxiety, be like mood instability, ADHD symptoms. It's sudden and dramatic and scary. Males tend to have it more than females, and median onset is age 7. So right there you can see there's a difference between the functional tics. It's triggered by infection, inflammation, and immune response is what is thought. So researchers recently, the one I just talked about from 2000, this past fall, did not find a connection. But I will want to point out that PANS and PANDAS remains controversial in the medical community. Okay. Meaning that some studies have shown connections, others have not, to strep infection and tics. But it's definitely something that's recognized, and a lot of you know, universities, clinics, you know, and physicians out there do see this and treat this. So I want to point this out about PANS. You know, to kind of look at what's going on. There are some cases post-COVID that might involve PANS or PANDAS, just as it was before the COVID happened, right? But PANS is not currently linked to the current surge of cases, right? That's what I think that's the best answer I can give about this, is that yes, there are some cases of PANS out there, but it doesn't seem to be linked to the current huge surge of cases, or researchers have not found that link, or most researchers. You know, there hasn't been, you know, a lot of studies, but really nothing that's, you know, at the forefront of what they're thinking. Stressful events of COVID have worsened symptoms for people that have PANS already, or so it's possible that you're seeing more exaggerated just because of a lot of conditions are worse with the pandemic. And it occurs in people, PANS occurs in people with or without primary tics. So people could have tics and also have worsening tics with an infection through like a PANS-like reaction, or they could just have it on their own. It's possible to have, you know, it's theoretically possible to have functional tics and PANS. It's possible to have functional tics, PANS, and primary tics. You know, as far as, you know, possibility, yes. I mean, these are some things that I think some clinicians try to consider. That seems like sometimes there's complex cases where it seems like there might be a bunch of factors going on. Treatment for PANS typically involves medication, CBT, and parent management training. So it's usually kind of addressing if there is an underlying infection or inflammation, And having cognitive behavioral therapy is really important to address OCD, and also a lot of parent management training to work on the OCD and other behavioral problems that come up with PANS. So this is not a discussion on PANS. Like I said, this is a kind of a quick summary. I know there's probably a lot of questions about all these areas. I just wanted to kind of cover that it doesn't seem to be linked to the big surge. But I want to point out that it's possible that it could be involved in some of the complex cases we're seeing. So let's look at this together of why this is happening. There was a shared global stress of the pandemic, which led to an increase in mental health problems. Functional tics have existed before the pandemic. Females have historically had more functional disorders than males. Functional behaviors can coexist with primary tic disorders, and social media seems to have played a big role in the mass development of functional behaviors and explains many but not all cases. Okay, so that's kind of a summary of what I just went through. I want to talk a little bit just quickly about my clinical experiences as from supervising many cases and during the pandemic at the Rutgers Clinic, but also my own work as a psychologist. I've seen a lot of complex presentations, mostly females and that are teens, almost exclusively females that are teens. Most of the cases I work with have a mix of symptoms, which seems, often traditional tics, some possible functional tics, OCDs in there sometimes, and also some cases been possible PANS. It seems like there was some kind of potential PANS going on in that, they were getting treatment for that. There's been some acknowledgement of TikTok and social media use, but I would say in my experiences through cases I worked with and even supervising at Rutgers, the students in many cases there, it's really, I would say it's maybe 60% to 50% and sometimes less, acknowledging they had social TikTok. So in my professional experience, it's been a lot less acknowledgement of TikTok social media, whether they were being honest or not, or but I take their word for it. And often people have a history of at least mild tics, anxiety, and depression. So obviously this is just a sample. I do want to talk about this one phenomenon that is kind of not talked about anymore and is like almost written out of the books. But for many years, for like 100 years, this phenomenon called la belle indifference, it's terrible pronunciation, it's a French term. It means a beautiful ignorance. It's basically a situation where there's like a paradoxical absence of psychological distress when someone has a serious medical illness or symptoms, right? So kind of where someone has really overnight, just cannot, all of a sudden cannot do something. It's a huge illness or something going on, and they almost seem like they're not really that concerned about it, or their level of concern just seems really not that high compared to what you think they would be, right? Like if you all of a sudden couldn't stop moving your arm and flapping it, you would think the person would be very nervous about it, but oftentimes there's kind of a sense of just kind of like, oh, what's going on? Now this is no longer used to diagnose, rule in or out functional disorder, but because it occurs in other conditions as well, not just functional. But I've found it occurring quite often in functional cases where the parents will often be extremely concerned about something, and the individual will kind of just be there and talk about it, but not seem as concerned that like all of a sudden they can't stand anymore, for a few minutes, and then there's just a sense. So I'm not saying this is a way to diagnose it, but I definitely think this is a phenomenon that happens, and I think that clinically it's helpful to know about it, because sometimes you can kind of work with that with someone and kind of work on their motivation and also have in their understanding of what's going on. So how to help. So let's go over some treatments and coping strategies that might help. So here's an overview. Now, there is so much here that every one of these could be its own presentation. So I'm just going to give a summary. First step is to find professional help and get a diagnosis. Second is to get your own personalized education after you get this diagnosis about what is a diagnosis, how does it work, and what's the plan. Comprehensive behavioral intervention for tics. CBIT is still recommended because there's definitely elements that could be helpful. Addressing comorbid anxiety and depression is often an essential component to working with functional disorders. Sometimes that's the main thing you're going to do. If you have more functional symptoms that aren't just tics, or the tics are more creating some kind of real difficulty in like movement or functioning. Sometimes people might need more of what you would have for traditional functional neurological disorders, like a rehabilitation and motor retraining program. So we'll talk a little bit about that. Medication, alternative treatments, I'll discuss, school accommodations, and take-home strategies. So let's go through this. So first, you want to find professional help, right? The first step is usually see your primary doctor, right? The first step for some people is go to the emergency room, honestly, if it's really sudden and severe. But then you'll probably follow up with your primary doctor. If you already have a neurologist, you know, you might go to your neurologist right away. Obviously, if it's really a scary onset of symptoms, the emergency room is probably going to be where you end up. But usually contact your primary doctor, especially if you have a good relationship with them. It's going to often involve a multidisciplinary team to help diagnose or work with this. And really in the medical, you know, you want a neurologist. Usually you want a movement specialist neurologist or movement disorder specialist neurologist that most neurologists would be fine to identify it, but a movement specialist might be a little bit more knowledgeable. And you need often having a psychologist or other trained therapist who works with tics involved, preferably if they have some idea about functional tics. It's not easy to find people that have a lot of experience with that and tics, but there are psychologists and other therapists that have training in functional disorders. School is important if they're teens. Getting the administration on board to be flexible is probably the first step, right? Like, hey, my kid all of a sudden having a sudden severe onset of symptoms. We don't know what's going on. Can you give us a break? I mean, that's kind of the big thing for schools. You know, so while we figure this out, if needed, like I said, if there's more the functional tics or there's other functional neurological conditions, you might need more of the rehabilitation route, which involves speech, OT, physical therapy, or a combination of those. And getting the diagnostic picture. What is this? Is this primary tic, functional tics? Is this sudden onset a PANS condition? Others or a combination? There's lots of things to figure out. So getting your education, this is pretty straightforward, you know, but it's very important in functional neurological disorder research and literature, you know, and anyone that works with this condition, the first part of treatment is almost always giving a diagnosis, explaining to a client and their family what this is, right? And this could be a huge thing because some people might swear that this has to have some kind of biological cause. There must be a toxin, there must be a reason, and it can be really tough for someone, and they could, you know, feel like you're not hearing them if you say this is functional, and we think it's more, you know, kind of psychologically based, it's and neurologically, you know, there's not a physiological cause. So one way to explain it is to say that it's a known unknown, right? We don't know exactly the cause, but we know about this. We don't know a specific cause. It's treatable. It's not your fault. It's a problem with how your brain works, right? There's better outcomes when the patient and doctor are in agreement. Often people are not in agreement. There could be multiple doctors that don't agree. So this sounds easy, but it's actually really not easy in real life. So often when people are on the same page, it could be helpful. And sometimes, you know, there's a lot to rule out. I think one area of that happens a lot is people really searching for a possible PANS diagnosis, looking for some kind of pathogen, and not being fully satisfied that there isn't something, there could be something, when it seems clearly more functional at times. So I think that's something that comes up a lot. Treatment involves retraining your brain, right? And I think that's something else to explain. We have to retrain your brain to kind of have normal and retrain it to have the normal automatic movements again, or voluntary movements again. And you want to review a treatment plan. So as far as CBIT is concerned, and this, if you're interested in learning about CBIT or comprehensive behavioral intervention for tics, I have a whole webinar on it. There's lots of information out on the web about it now. It's amazing how in the last 16, 17 years it's become like normal to talk about this. And the top treatment years ago it was considered forgotten about, and you can't do this with tics, and now it's pretty popular. So I'm just going to give you a quick overview now about this, but so CBIT involves usually a combination of something called habit reversal and functional based strategies with some relaxation training. So the functional based strategies can be key for functional tics. So this is looking at really modifying the environment, looking at what happens before and after the symptoms occur, the antecedents and consequences, So kind of looking at mitigating potential triggering exposures, reducing and eliminating social media exposure could be the #1 thing you do. Just, all right, we're not watching TikTok videos of people ticking anymore right now. Like, let's just stop. Or YouTube. Reduce attention for it. So how parents and others around react to when it's going on. Modifying responses, and considering that there's secondary gain. So this is not this happens in many conditions, not just functional conditions, but sometimes, if someone has something that's debilitating, they might, not have to do some things for a while, and it's not why they're doing it. It's just they get these other, and so considering, if all of a sudden you don't have to do schoolwork again for 2 weeks, considering that as part of like, well, let's try to incorporate some schoolwork or some other aspects in. Obviously, everyone will have an individualized plan. Regular habit reversal, right? This is what works for primary tics, so the traditional tics. Sometimes you could try this because we don't always know if it's functional or not, and it might work. And I found that it often does, because it seems something that might seem more functional could be more primary. So it's a way to kind of try it out. So it involves kind of being more aware of that tic urge before it happens and describing it in detail. So we do awareness training. Once someone's aware of the tic, we will incorporate an opposite or competing response. So it's catching the tic before it happens, or interrupting it as it's happening, engaging in incompatible behavior, and holding this for 1 minute until the urge goes away. The other part is having support when you're working on this, right? So having family support you. One thing I'll say about habit reversal is it's not an alternative or replacement behavior. We're not replacing the tic with another behavior that satisfies the urge. So if someone moved their neck in a regular tic, a traditional tic, because they have an urge in the part of their back, I wouldn't have them move their neck another way to satisfy that urge. This is a competing behavior. This is an opposing response. We don't want to satisfy the urge. So addressing comorbid anxiety and depression is often, I would say, like in the top 3 things you should do for most functional conditions. If you reduce the stress level, you often see a decrease in the functional behaviors for especially the functional tics for many people, and traditional tics as well, but particularly these behaviors. So cognitive behavioral therapy, doing, restructuring how you think about the situation, relaxation training, potential exposures to anxiety situations that are feared, and behavioral activation for depressive behavior. So kind of not avoiding and withdrawing, kind of getting back into your life and more active. Other CBT modalities like motivational interviewing, DBT, mindfulness, ACT, incorporate a lot of these aspects and can be very helpful for that, kind of reducing the anxiety and depression. In general, I will say on here, stress management interventions, problem solving is sometimes not thought about. You don't have to sometimes go to some intensive therapy. Sometimes just think, what is causing this individual to be extra stressed right now? Besides these, oftentimes with teen girls, it's, starting high school, having, sometimes the pressure of the class, of the academics. There are a lot of students who feel very pressure after having, virtual learning, getting back into more rigorous academics, or some students simply take 8 AP classes as a freshman, and I'm exaggerating, and they don't sleep. And that might be something that he's like, maybe we should reduce that now. So sometimes the stress management interventions and problem solving them could be the very first strategy that you don't need a professional for, that you can think about to help bring the volume down on everything. And supportive talk therapy can be helpful as well. So rehabilitation and motor retraining, this is not going to by any means be, this is just one slide on this. This is the whole topic that do not professionally do too much of. This would happen more in an inpatient usually, or even an outpatient, but in a hospital kind of situation, but it involves basically retraining the brain for functional conditions. Oftentimes it's for, tremors, or loss of movement, or the psychogenic seizures, kind of noticing, the patterns there. But it can be modified for tics possibly. There isn't a lot of research on that. But the idea is that and one thing I highlight here is this is I have resources at the end. This Nielsen paper kind of gives a lot of examples of basically retraining a movement. So someone might have trouble with their arm, you might have them focus on their other arm they have more voluntary control on and divert their attention and practice moving that arm in a controlled manner to help kind of bring the other arm along. So there's different ways they use distraction, diverted attention to retrain movement. They will, try to reduce using adaptive equipment. So kind of typical rehabilitation aspects. And there's a lot of psychological aspects of challenging your beliefs, maladaptive beliefs and relaxation. So let's talk real quick. I'm almost done, everybody. I know I've been talking nonstop for a while, but medical, okay, so for the medications that work for primary or traditional tics like Tourette syndrome tics are the antihypertensive, the alpha-2 drugs, guanfacine, clonidine, and Tuniv is the extended release guanfacine, and the neuroleptics, the atypical antipsychotics, or the traditional antipsychotics that work the best for tics. They usually have little effect on the functional tics, right? Occasionally, you'll find a placebo effect where someone will help miraculously recover better than anyone primary tics would by giving a one dose of a medication or something for functional tics. But often there's little effect on it. What's most usually targeted are the comorbid anxiety and depressions medication to address that, like SSRIs, like Prozac, Zoloft. Those are common ones, Lexapro. So other medical procedures like Botox and deep brain stimulation, which are used for more severe cases of Tourette syndrome or other primary tic disorders, not typically used for functional tics. Botox would address some pain. Usually it's for a painful neck tic. Some docs, I'm just putting this on here, it's not recommended for functional tics, but a lot of people are will still try to rule out PANS or PANDAS are there, particularly because it's hard to find sometimes if something was going on. And so some people will be taking, prophylactic antibiotics or probiotics or anti-inflammatory medication. It's not recommended. I'm not recommending. I'm just saying that sometimes you'll find people that are trying to just rule that out at the same time. Alternative treatments, there's limited or anecdotal evidence, but some families try THC or CBD supplements, or THC or CBD or supplements, right? There was a very small study documenting people that have functional tics using THC or CBD mix. I think they were self-medicating. I don't think it was a controlled study. It showed that they had some improvement, so I'm not saying I would think there were 5 people documented, but it's just, it's for primary and traditional tics, there still is not a lot of research on marijuana or THC CBD for it. So it's something that is it's still considered alternative, right? And there's no supplements that are known to cure functional tics. Like I said, it's more of a psychological root cause of like a software problem, not a hardware problem. Hypnosis, and thinking about the suggestibility of functional disorders, there's some research that show that it might be helpful. I would be careful just jumping into anyone that does hypnosis and try to maybe go through a functional a center where people focus on functional tics or functional disorders first, but it possibly could be helpful. I don't know much more about it than that, so I know there might be a lot of questions, but that's just, there's been some research showing it's helpful. I don't do hypnosis with functional, but I just want to point that out. Educational accommodations, like I said before, sometimes this needs to be an immediate stopgap because these are a sudden disruption in someone's life. So school people, if you're listening, I worked in schools for 13 years as a psychologist and administrator, so I understand the complexities of this, but sometimes you have family in the situation. If you can just be flexible in the beginning, it'll change maybe in a few weeks, but try to reduce the stress, the load, modify the work, have a liaison in school. Any of these options could be helpful. With any tic disorder, functional or primary, I think general coping strategies are what most people use to get through their days. So distractions, fidgets, gum, breaks, having a stress ball, adjusting the environment to make it more relaxing. Helpful activities like sports, music, yoga shouldn't be overlooked as helping to reduce stress and also improve the quality of life for individuals going through these situations. So some take-home strategies, and then we'll take some questions for addressing functional tics. The first thing I would recommend after going to your doctor, and is greatly reduced social media exposure. If it's, at this point we think it's linked. So it's not to punish the individual. It's because, if these tics are really disruptive, let's try to like see what happens if we reduce social media exposure. Easier said than done for most, I get it. Reduce attention for the functional behaviors. So try to increase attention for other behaviors and reduce attention for the functional tics as much as possible. Obviously, if there are self-injurious behaviors, you can't just ignore that. Obviously, you have to take safety into consideration, but to try to not focus on them as much as you can. Reduce general life stress. Consider the course load of people in school, the activities, exercise. Are they basically busy all the time and not stopping? Maybe we need to like slow this down a little bit. Increase stress, reducing activities, downtime, exercise, things they enjoy, and try to get back to normal routines a little, as soon as you can, even if you're gradually getting back into your routine, and trying to think about, try to get back in school more in person if you can, have less time socializing and not just with your caretakers, right? Because a lot of times what happens, kids will find themselves with their parents all the time now. So you want to kind of try to get back to more of your normal routines, reducing doctor's appointments if you can, right? And reduce how much the family and parents are accommodating a behavior. So there could be oftentimes a relationship between how much attention the kids are getting and how much they depend on their parents. So trying to, really the theme is trying to get back to normal and reduce stress. Roles for different stakeholders. Oh, I forgot about this slide. Sorry, everybody. Real quick. Individuals with functional tics, stay positive. This is treatable. Work on your motivation, right? Parents, find providers, reduce stress, minimize attention, stay calm in front of your child. Try to stay as calm as you can. I know it's easier said than done. Clinicians, communicate with each other. There's often many clinicians, and we know we don't do a great job always communicating with each other. So let's try to do a better job if we can. And schools, be flexible, understanding, and accommodating. Okay, so sorry if that was too long, Kelly and everybody, but that was a reduced amount of slides compared to what I had before. This is a huge topic with lots of sub areas. If you're interested, there's resources on the slides. Referrals, New Jersey, NJCTS, who does this webinar, is basically your source in New Jersey. If you're outside New Jersey, the National Tourette Association has a listing of trained certified providers of CBIT and other areas related to tics. There's online CBIT training for tichelper.org. The Tourette Association has a website on their page, a web page about this situation that has a summary, kind of similar to what I went over. And they also, the webinar I mentioned, here's the link to it. If you go to TAA website, they do a webinar on this topic as well. If you want websites, there's a bunch of information for functional neurological disorders. Most of them are in the UK or Australia or in Europe, but there are a bunch of resources. Stanford has one for if you have kind of functional neurological disorders, describing it. And there's some of them are for kids. NeuroKid is kind of a good one for children. Okay, is my contact info. My prior practice is in Rolls End, New Jersey. I do virtual though. I'm licensed in New York, New Jersey. My PsyPac license me. I could work in like 36 other states is pending as soon as they approve it. So I should be able to work in other states virtually as well. Teletherapy at least soon. And the references are all here. So, all right. So Kelly, is there any questions? Are people still on, or do they all go to sleep at this point?
No, they haven't gone to sleep, and yes, they are still hanging in here. So we'll start with our first question that came in. If a teenage girl had a simple head neck motor tic from April of 2021 to January of 2022, then began a sudden onset of short vocal tics and a more impressive head, neck, and hand and motor tics, would this be a primary tic disorder and a functional tic-like behavior, or just worsened primary disorder?
Okay, so I didn't write everything you said down. So it started with what area, Kelly?
It was a head and motor tic. Or yeah, I'm head and neck tic.
How old is this person?
Not listed.
Okay. I mean, it doesn't sound like a functional tic to me, but there could be some functional aspects to it. I mean, starting with a head movement is not, and if it was a teenager and it was, you know, involving other complex movements all overnight and it wasn't as gradual. But traditional tic disorders do come in waves. They wax and wane, right? So as part of my cutting this presentation out, I didn't go into all the aspects of traditional tic disorders. There's a lot of, I have other presentations on that on this website, and there's other ones. So, but tic disorders, even the primary ones, wax and wane, and they could start with a few tics, and then it can kind of all of a sudden seem like a lot are coming on at once. But generally, the difference is they usually have a somewhat gradual start in the beginning, and they could have, like, you know, they can just jump up at some point. The functional tics usually just come on like a bang. It's like overnight, they're all there and complex. So I'm not in a position to diagnose someone I don't know, but I would say it sounds more primary to me from what you're saying, but, you know, I guess you'd have to talk to a professional. And like I said, there could be combinations. So someone could have, a lot of people that had these functional tics that I worked with seem to have primary tics as well. So we don't always know. It'd have to really be ruled out.
Okay. I have a child whose tics didn't develop until they had a TikTok account at 16.
Mm-hmm.
When they tic, they mimic the same tics that are on the popular TikTok.
Okay.
They look at the parents for a reaction, and they appear excited about their tics, looking to ensure we witnessed them, which I know is not typical of TS diagnosed children. What's the best approach in these situations?
The best approach is, like I said, to minimize attention, right? Like to not, I would say, you know, you could obviously go to, one approach, I don't know what approach you exactly mean, but if you mean, you know, you could always go to professionals, like a psychologist, or just kind of rule out what's going on, you know, to see if they're more traditional tics, and if they are, you can work on them, or even functional tics with some of this, you know, the C bits we talk about, or addressing other comorbidities. But if you're talking more about how to respond in the moment, you know, I would say that kind of what I had on the take-home slide of minimizing attention. You know, if they're looking for your attention, it's fine. I mean, you can't avoid a child in front of you doing something, but and looking at it. But I would just kind of have a minimal response and try to focus on the behaviors that aren't the tics. You know, and like, oh, when you talk about something else, distract them. You know, but kind of let it happen and kind of be minimal, and then later on bring up the other. You know, I wouldn't give a lot of attention for either anything while it's going on.
Okay. Would you recommend a quote dopamine diet that is a break from social media to weed out the rewards of affirmation for exhibiting certain symptoms versus not having that reward for potentially mimicked behavior?
Well, like I said, I think it's a tough thing to tell a kid to get off their social media account if that's a huge part of their life. But if you're seeing a lot of tics, I think some parents, even with traditional tics, will sometimes, you know, reduce how much technology their kids have. I don't like to across the board recommend doing that, because sometimes every situation is different. But I would say if you suspect there's functional tics, it's something you can consider is taking a break and see how it goes. You know, let's kind of and I would try to get your teen or your child on board, like, hey, this isn't really, let's see what it's like to not do this, and maybe replace it with something else that's enjoyable for them, or make it worth their while, so they don't feel like it's a punishment.
Okay. So I have my next question is really long. So I'm going to try and truncate it without losing anything. Recently, research literature suggests that the sex ratio of autism spectrum disorder is incorrect, and that a difference is actually better defined by a variance in system presentations. Is it possible that that is the same occurring with TS and tic disorders?
I mean, I would say it doesn't seem like that's the case, but it could be possible. I mean, I don't, the gender break, the sex breakdown for Tourette syndrome has been kind of relative, it's been pretty consistent for a long time. Um, I think tic disorders are potentially in some ways easier to, pick out than autism sometimes, in that, you visually are looking for motor tics or vocal tics. So I I don't really, I think that there is, though, something to be said in that question, that there is research out there and looking into kind of how females experience, biologically females experience tics, and how that trajectory goes. This is traditional tics over time, particularly seem to have maybe slightly poorer outcomes as adults, and there could be some differences that are there, but I don't think that the ratio is totally off. I mean, it seems unlikely, but it's possible. I don't know if that was a tough question to answer simply, but that's a good point, though. There are, I think they're still really trying to figure out if there's, the gender differences there and how it's experienced more than the ratio of how many have symptoms. The functional disorders have historically been more female, though, and really we're not really sure why. It seems like there must be some kind of genetic or biological link there, but I haven't really got an answer on that one.
Okay. My daughter has a history of panic attacks and now has an anxiety disorder diagnosis. Both of her brothers have diagnosis of Tourette syndrome. And since COVID-19, she has been worse. She has a neck tic and an arm flap, and both arms would do something when she had night terrors. She also has a past history of excoriation. I'm wondering, do you think she has Tourette's, and is it coming out now, or is it just related to the surge you're talking about? She is 14.
It's well, I think you really have to go get it checked out by a neurologist. That's what would be my recommendation. I can't diagnose just from a question. I think there would have to be, I think that there's so many possibilities when I hear about tic cases that I think you really have to take each case and talk about it. But I think it's possible either way. It's possible it's a manifestation of a traditional tic disorder that just got worse in teen years and maybe exacerbated by the stress of the pandemic. It could be a combination, or it could be possibly functional tics. But I think that you'd have to go to a neurologist. I would say a movement specialist neurologist would be a good start.
Okay. Next question. I think my daughter has a functional tic-like behavior. She tics. She's in quotes, sorry. She every box you had mentioned, including the sudden onset of complex physical and vocal tics. She's 14 and watching TikTok. TikTok Tourette videos before sudden onset of behaviors. My husband is still very worried about something physical, although she had an MRI and EEG and a lot of other tests. The MRI wasn't clear because of braces. And our current neurologists and therapists think we should treat this like a functional tic-like behavior. I'm worried because I'm avoiding, yeah, my apologies. They're avoiding additional doctors and testing because it's making things worse. Is there any advice for our family?
Well, I would, I mean, if you're a therapist and the doctors can work with you on, and if they're functional, kind of working on some of the functional interventions like that are in CBIT, you know, trying to modify the environment, reduce stress. I would work on that while, you know, if they're still looking for some some biological cause of this, you could always do that while you're getting the other interventions in place. But remember what I said before, that oftentimes with functional conditions, the biggest part is having everyone on the same page about the diagnosis. Oftentimes people are worried about, you know, being, you know, the functional diagnosis is often hard for a lot of families to take, in that it seems like there must be some kind of cause. So you could keep looking, or, you know, maybe, you know, go with what they're saying and work with them on, you know, some strategies for that, you know, as we outlined here, or whatever they'd recommend.
Okay. Do you believe there is any correlation between sudden onset tics and the increased level of roughhousing, socially inappropriate physical touch interactions seen from younger children and adolescents?
I don't think that is linked to this current surge. I think this current surge is more linked to people watching I think a lot of the cases in the surge were linked to the TikTok videos, right? But I think there's other aspects, like primary tic disorders have surged, have gone up. Cases have gone up for regular tic disorders during the pandemic, and I just think that I don't think that's the specific type of video, but it's possible that they're linked to it. It just seems like that is not what we're seeing.
I have a son that's 16, and he wanted to spread awareness of Tourette's until he reached high school. Now he doesn't want anyone to know that he has it, but
Okay.
I'm concerned his tics have started again, and can looking at TikToks and social media make that worse?
Like I said, I don't want everyone to come off this and like immediately take all their kids off social media, because they might not be happy, and I don't want to get many angry phone calls from like people across the area saying, you know, why am I not allowed to be on social media anymore? I would say that tics wax and wane naturally, right? So if your son has had it was a son, right? I'm trying to remember.
Yes.
Had tics before, and that they're coming up again. Particularly if he's 16, there could be more stress going on in high school at that age. It's not abnormal for tics, just don't go away for everybody when they're a teen. Sometimes they come back. With that said, you know, there are many factors that can cause primary tics, regular typical tics, to be exacerbated, right? So sometimes people in general the tics are more exacerbated by stress or tiredness, sometimes excitement. So sometimes for anyone with tics, watching social media or entertainment or playing video games could get them to tic more, but that doesn't necessarily mean it's a problem, right? My working model for working on tics is this: there are 4 reasons to work on tics, right? Otherwise, I generally would say, like, just let it be. If it's not causing a problem, if it's causing someone pain, if it's could cause an injury, if it's really bothering the individual that's ticking and they just don't like it, or if it's potentially or is disrupting other people or insulting other people around them, right? So if your son is having more tics, but it's not really causing him distress or bothering, parents sometimes will be concerned that it's, you know, socially not going to be that appropriate. But I think you could work with your child. You could say, let's try not doing social media for a day or 2 and see if it helps reduce it, if you want to do that. Or they might say, I don't want to. I'm 16. I want to be on my social media. I don't really care. So I think it really depends on the individual. And when I work with people in these situations, we kind of talk about the pros and cons of both. And you know, I think tics can naturally wax and wane. Yes, we think that they can be spurred by suggestibility from the video. So one thing you could say specifically is maybe don't watch the TikTok videos, or the TikTok videos about tics. Like that might be, we think that might have a more specific link to it. As you know, suggestibility is like, you know, you could be on, watch your YouTube videos about Minecraft or you know, Fortnite, but you know, maybe not the TikTok alphabet challenge, the Tourette alphabet challenge.
All right. How do we differentiate between tics and repetitive OCD rituals and behaviors? For example, knocking on walls, hopping over lines. They just noted a sudden onset of vocalization such as "stop it, stop it, stop it," and also repetitive F-bomb tics. There was not much use or even much use of TikTok or social media with this individual.
Yeah, I mean, okay, so there's a bunch of questions. There's a bunch of questions and statement in there. So I'm just gonna, so the differentiation between tics and OCD, I mean, that's a whole discussion, but basically tics, usually primary tics, traditional tics are, usually it's more of a physiological urge that you're responding to. So someone will get an urge in their body, and usually, not always, but most of the time in the area of the tic, a feeling like kind of similar when you have an itch you want to scratch, or when you feel like you're going to sneeze, or it might be like a pressure or something that's uncomfortable. We call that a premonitory sensory urge or a tic urge. And the tic's function is when a tic happens, it temporarily reduces that urge, right? So tics are most of the time, almost always a physiological response or a physiological uncomfortableness. OCD is usually it's an impulse control and anxiety disorder combined. So basically the O is the obsessive worry thoughts, and the compulsion is the ritualized behavior that helps you avoid your worry, right? So it's basically you have your worry and you have your way of avoiding that worry, and it doesn't always make rational sense. So in OCD, usually the behaviors, and oftentimes people with tics and OCD don't have as well, they can have both, but often they have unspecific worries like, I just feel like something's not right. It's not always I'm washing my hands because I feel like I'm going to get COVID, a specific worry. It could be something like, why do you jump over this line? It just doesn't feel right. But the difference between tics and OCD is that the obsessive thoughts are more of a mental worry kind of feeling, where the tics, it's a physical premonitory urge. So that's how we differentiate. Usually is it more physiological? Do you feel something in your body, or is it more of a worry that something's just not right, or you feel like something bad's going to happen if you don't do this behavior? We do have tic pulsions, which is when you have combinations of both, and that's why this is a whole other discussion. But it's not as common, and sometimes which means you have people report a physiological urge, but also kind of an OCD type worry along with that urge. To treat that, I'll usually do like a combination of CBIT with what we do for OCD exposure, kind of merge the two, have a competing response with kind of paired with some kind of exposure. And sometimes when you do that, you find out like if something's more of a tic or OCD. But the other part, I'm sorry, Kelly, I forgot what the other part was of that, but that's.
Yeah, I think you answered the primary part of that question. So the last question, because we are running late. Have you seen an overlap with tic disorders and transgenderism, specifically female to male?
Honestly, yeah, it was on one of my slides, and I don't think I actually mentioned it when I was talking about my clinical experience. Oh, did you just go back to my screen? Can you see me? Am I on still?
I can still see you, yes, but
Okay.
what we're viewing is our
Okay,
slide.
sorry, something happened. Yeah, so I had not seen anything in the research literature, but I will say in my clinical experience, I've seen this is actually, I saw this question actually, I think it was one of the questions you emailed me before. I've seen a correlation between identity, just gender identity questioning, which is also increasing in general in the last couple of years, but specifically in these functional cases, a lot of the biologically female individuals that, through my clinical supervision experience, have brought this up, right? So I would say that I have not seen a study done on it, but as far as anecdotal and professional experience, there's definitely some kind of link. I would say majority of cases have some of this in it. So that is actually a really important piece to bring up and needs further explanation. I don't think it's a cause, but I think if you look at functional disorders as or functional conditions as having some sort of dissociation involved, or you know, it's kind of a way where the brain takes extreme stress and kind of translates it into a physiological response. It kind of makes sense, because if you're, and also the age that a lot of these girls are experiencing in general, even if they're not having, you know, gender identity, just it's a tough time for, you know, for a girl at 13 to 15. Not that I could personally speak to it, but as far as you know, just kind of identifying, kind of going from middle school to high school, early high school, and I think that there's a lot of stress there in general. But I have seen a link, so I'm glad that question was asked, and I didn't point it out when I was talking, but I think I had it in one of my slides. Okay.
For any questions that did not get answered this evening, I will be putting them up on the chat board, and Dr. Hartke will have an opportunity to answer them there. I want to thank you all for joining us on our webinar on understanding and responding to sudden onset tics in teens. There is an exit survey which we need everyone attending to fill out. The webinar blog is open and available for the next 7 days on the NJCTS website for any questions that were not covered in tonight's presentation. That website is njcts.org. Also, an archived recording of tonight's webinar will be posted to our website. Our next presentation is next Wednesday, the benefits of a neuropsychological evaluation, and it will be presented by Dr. Christine Sparazza, and is scheduled again for March 2nd, 2022. This ends tonight's webinar. Thank you, Dr. Hartke, for your presentation and your 8 previous ones. And thank you everyone for attending. Good night.